So, before we dive in, what exactly is an environmental risk assessment or ERA? Simply, but it's a scientific framework. We use it to calculate the likelihood and the scale of damage that human activities can cause to the nature and human health. Think of it as a defensive tool to protect our ecosystem. When we talk about pollution, most of people immediately think of industrial wastewater, factory smoke, or plastic bags choking our oceans. But there is a sneaky invisible hazard that often gets ignored, which is active pharmaceutical ingredients, or we call it as APIs. So, how these medicines end up in nature? Well, globally, research shows a very worrying trend. Most households around the world simply throw unused pills straight into the household rubbish bin, or they flush them down the toilet and sink. While this feels like an easy way to get rid of trash, it carries several hidden consequences for the environment. But despite this program, a massive amount of chemical medicines still completely bypass this safe loop. Why? Because many citizens doesn't know the program exists or find it as inconvenient. Instead, these capsules end up in ordinary local landfills. When it rains, the chemicals dissolve, leach through the soil, and flow directly into the groundwater and major Malaysia river basin.
My name is Cik Nur Najwa binti Cik Alias, S76132, and I will continue with hazard identification. Pharmaceutical pollution mainly comes from two sources, which are point sources and non-point sources. One type of pharmaceutical hazard is anti-inflammatory drugs or NSAIDs. According to studies, these drugs can cause oxidative stress, DNA damage, and behavioral change in aquatic organisms. Another major hazard is antibiotics. When antibiotics compound was released into water bodies, these compounds can kill aquatic organisms and promote antibiotic-resistant bacteria. This issue is dangerous because antimicrobial resistance is considered a global public health threat. Hormonal medicine, such as contraceptive capsule, may destroy endocrine system in aquatic organisms. This affects their reproduction and growth. Psychiatric and neurological drugs may also cause bioaccumulation and reduce fitness in aquatic species. Improper disposal of pharmaceutical waste can cause serious environmental hazard. This includes water pollution, soil contamination, biomagnification, and microplastic pollution. Exposure to these pollutants may reduce reproduction rates, alter swimming behavior, and affect predator avoidance in aquatic organisms. Pharmaceutical pollution may also affect human health through indirect exposure. Humans may consume contaminated drinking water, seafood, vegetable, and dairy products. The possible health effect includes DNA damage, endocrine disruption, allergies, cancer risk, and antibiotic resistance. Next is dose response or effect assessment. The assessment studies the relationship between the concentration of pharmaceutical pollutant and the severity of the effect. There are several important toxicity indicators used in environmental risk assessment. First is EC50, second is LC50. Another indicator is NOAEL, which is the highest concentration where no adverse effects are observed. One important issue is the cocktail effect. This happens when multiple pharmaceutical compounds mix together. Although each drug may exist at low concentration, their combined toxic effects can become much stronger than individual toxicity. Studies show that pharmaceutical pollutants can cause many harmful effects on aquatic organisms. The effects include antibiotic-resistant bacteria development, reduced growth, neurotoxicity, blood cell reduction in fish, and reproductive failure. And long-term exposure to pharmaceutical pollutants may also affect humans, where the risks include kidney and liver problems, antibiotic-resistant disease, and neurological disorder.
Assalamualaikum. My name is Azim Shazwi binti Suzaki. My ticket number is 76131. Today I will be discussing our exposure assessment. Basically, we're looking at how improperly disposed medicine move through the environment. Let's look at two main scenarios. Scenario 1, surface water exposure via point source discharge. The first pass is through our wastewater. The pathway, household, pharmaceutical residues enter municipal wastewater. The conventional treatment plant lacked the specialized infrastructure necessary to neutralize complex chemical compounds. When medicine enters the cell system, treatment plant can fully remove the active chemical ingredient. The receptor means the result, this chemical flows straight to the local river and lakes. And the ecotoxicological impact established the persistent cycle of aquatic exposure, empirical sampling confirmed chronic contamination with specific active compound demonstrating continuous elevated concentration, which accelerate the proliferation of antimicrobial resistant genes in local reservoir. This creates a persistent cycle of contamination that not only harm the ecosystem but accelerate the growth of drug-resistant bacteria in the water. Next is scenario 2, the human exposure via groundwater leaching. The second pass is through our groundwater. The pathway, pharmaceutical compounds continuously percolate into subterranean aquifers, driven by the permeation of agricultural runoff and seepage of municipal leachate into the soil. The receptors, human population relying on these ground and surface water bodies for their municipal water supply. Here, medicine from farm runoff or leaky waste site, which is landfill, slowly soak deep into the soil. So the big problem here is that this underground aquifer often supply our municipal drinking water. So the public health risk this chemical build-up in drinking water system. Consuming tiny amount of this drug over a long period increases health risk, especially for communities that rely on standard groundwater treatment. This means communities are exposed to a chronic low-dose mixture of this chemical over time, creating a major public health risk.
So, moving on to section 6, let's discuss how we can manage and solve this pharmaceutical hazard. To create a truly effective mitigation strategy, our group used a multi-barrier approach. This means we look at the current gaps in the Malaysian system first, and then propose administrative, social, and engineering solution to fix them. Right now, Malaysia actually has an initiative called the Return Unused Medicines or RUM program, started in 2010. It allows patients to return expired medications to government clinics for safe incinerations. However, our group identified 3 massive gaps holding this program back. First, low public awareness. Studies show that up to 70% of Malaysians they throw solid pills straight into the household trash bins simply because they don't know it harms to the environment. Second, accessibility limits. The program is trapped inside the government facilities. To return medicine, a citizen has to make a dedicated, inconvenient trip to a government hospital or klinik kesihatan. Third, regulatory gaps. While industrial pharmaceutical waste is heavily controlled as a scheduled waste code SW402, household medicine waste is legally treated as ordinary garbage. This means it's lawful end up in basic landfills where the chemicals easily seep right into our groundwater. To patch these gaps, we propose 3 distinct solutions. So our first is administrative solutions. Expanding the RUM program to the private retail pharmacies like Watsons, Guardian, or Caring by introducing a customer reward system like membership points or cashback rebates for the returning empty blister packs. We make safe disposal highly accessible and rewarding. The second is socio-behavioral solutions. We propose adding mandatory, highly visible eco-disposal labels or QR codes directly onto medicine capsule packaging. This continuously reminds consumer right at the moment of use. Do not flush, do not throw away, return to the nearest pharmacy. So finally, our absolute safety net is an engineering solution. Conventional Malaysian wastewater plants use active sludge, which cannot destroy complete chemical medicines. We propose a pilot upgrade using an advanced oxidation processes or AOPs, combining UV light and the hydrogen peroxide. AOPs generally highly reactive molecules called hydroxy radicals. These radicals aggressively shred the tough chemical rings inside capsule medicine, breaking them down into completely harmless mineral end product, which is carbon dioxide and water, right before the water leaves the treatment plant. So, based on this equation, the target is persistent active pharmaceutical ingredients or APIs possess complex chemical rings that standard biological treatment cannot dismantle. So the mechanism is hydroxyl radicals act as powerful non-selective oxidizing agents. They aggressively attack the electron-dense bonds of this medical ring structure. So the result is the processes force mineralizations completely cleaving the toxic organic rings apart and converting them onto the entirely safe, basic and end product, which is carbon dioxide and H2O. While the high electricity costs mean we should implement this selectively downstream from the hospitals or dense housing zones, it provides a powerful engineering barriers to keep our river basin safe.
Now let's look at risk characterization. This is where we talk about how this drug actually affect our environment and our health. First, we look at the ecological risk and exposure, which mean the environmental impact. The systemic discharge of active pharmaceutical ingredient bypass inefficient treatment plant. The main problem is that downward sewage treatment plants cannot break down the complex medicine like antibiotics and hormone. Because of this chemical flows straight into our river, that leading to dangerous exposure concentration. For example, tests in the Convat River found very high level of antibiotic ciprofloxacin up to 299.88 nanogram per liter. This constant pollution is highly dangerous. It builds up the bodies of fish and severely harm aquatic life, causing the bioaccumulation in commercial fish and physiological disruption in non-target aquatic species. And second, the human health vulnerabilities, which mean the impact on human health. This pollution doesn't just stay in the river, it leaks down into our groundwater. Groundwater tracts, municipal and agriculture reject heavily contaminated aquifers, creating complete exposure routes for highly reliant regions like Kelantan. Where 19% of water supply come from the underground, this creates two huge health risks, which is population face direct toxicity risk of ingesting contaminated water, alongside the severe acceleration of antimicrobial resistance (AMR). When low levels of antibiotics are always in the water, bacteria become resistant to them, creating superbugs. So next, infrastructural context and mitigation. These risks happen because of bad disposal habit and outdated water treatment. Require intervention mitigating the systemic disposal failure demand, advanced tertiary wastewater retrofit. For example, fungi-based bioremediation and targeted campaign to modify household disposal behavior. Which means to solve this, we must upgrade our water treatment plant with advanced technology, like using a fungi to break down the chemical, but just as importantly, we need to strong public campaign to teach people how to throw away their old medicine safely.
Assalamualaikum warahmatullahi wabarakatuh. My name is Sita Aisyah binti Kamaruddin, matrix number S76057. My part is the regulatory and policy frameworks. First is the regulations. The regulations involved here is the Environmental Quality Act 1974, EQA, along with the Environmental Quality Scheduled Waste Regulations 2005, as stated. It established the legal framework for management of hazardous waste and scheduled waste in Malaysia. Now, these schedules are important to ensure waste that could harm human health or environment are identified, stored, transported, treated, and disposed in a safe manner. Pharmaceutical waste are designed as SW403, scheduled waste according to the first schedule of the regulations. This classification encompasses that discarded drugs, medicines, pharmaceuticals, and contaminated materials. Next is the frameworks. First, we have the packaging. In accordance to Regulations 9 in bracket 1 of Environmental Quality Scheduled Wastes Regulation 2005 under Sub-Regulation 1, waste must be stored in compatible containers. Therefore, pharmaceutical waste, such as expired medicines, must be kept in pharmaceutical bins. Next is storage. In compliance with Regulation 9 in bracket 2 of the same environmental law, under Sub-Regulation 2, incompatible wastes, such as medications, must be kept apart and kept in a special safe locations. Lastly, we have inventory and consignment. In accordance to Regulation 11 of under the same law, using the Department of Environment's Electronic Scheduled Waste and Information System, ESWIS, generators must register, inventory, and monitor their waste. Last but not least, the conclusion. In summary, improper disposal of pharmaceutical capsule waste is a threat to both environmental and human health in Malaysia. Active pharmaceutical ingredients, APIs, from unused or expired medications can infiltrate water and soil, resulting in pollution, bioaccumulation, antimicrobial resistance, and detrimental effects on aquatic ecosystems. Research conducted in Malaysia has identified pharmaceutical residues in rivers and wastewater systems, underscoring the urgency of addressing this matter. Despite Malaysia's implementation of regulations under EQA and initiatives like Return Unused Medicine RUM program, challenges such as low public awareness, limited accessibility, and insufficient disposal practices persist. To mitigate pharmaceutical pollution, Malaysia should fortify medicine return programs, enhance public education regarding safe disposal methods, and modernize wastewater treatment system with advanced technologies. Ongoing monitoring and stricter information enforcement of waste management policies are also crucial to safeguard ecosystem, water sources, and public health. That's all.